At the moment, but at the moment it's not too bad, but it was a little aggravating.
Yeah. Rained pretty hard coming over?
I was fine. No, I've sprinkled a few times.
Oh, gee, we had really a downpour here.
It looks terrible, but it really isn't.
Yeah, well, it was one of those ones for a while you could hardly see the bottom of the street from out here, so.
All right, well, let me, I'll tell you what we did. We gathered a little over 900 petitions at the Erie County Fair. That's the purpose of this big stack right here.
It's a good stack.
Split them in half so that we can share them with you and share it around.
Okay.
So that's the purpose. That was the project itself, and then the message. And I'll read the last two signs because that's the the essence of everything. Senator Voinovich, I urge you to publicly oppose President Obama's $1.5 trillion government health care takeover and rationing scheme on every vote, and oppose any other bill that would expand the government's role in health care. The free market is the most inexpensive and most efficient way to ensure American citizens get the health care they need.
Alrighty.
So that is your stack.
Now, this is half of them, or this is 900?
This is half.
Yeah.
So that's 450, 475. At some point there, I lost track of the exact count. I guess what I wanted to, to dwell on, because I did the same thing with Sherrod Brown yesterday, and one of the things that I guess always seems to come up when I talk about the free market is what is the free market.
Mm-hmm.
I would like to think that you understand this, but I'm beginning to get the feeling that people seem to think it means doing nothing rather than respecting liberty. Because, liberty is what it's all about. That's what the country was founded on. And the idea is to empower or allow people to do the most that they can for themselves. As this issue has unfolded, a number of issues have come up that I guess need clarification. The insurance industry is frankly socialized at the present time. It contains a mishmash of federal and state mandates, which effectively makes health insurance companies unable to really compete favorably or easily. It prevents them from offering their products over state lines because different states require different mandates, and it causes massive confusion. And it's an area that if you wanted to have health care or health insurance reform, this would be number one. Allow the insurance companies to be insurance companies.
Yeah,
that's really it's as simple as that.
I just heard yesterday on one of the radio shows that in some states, because of this provision, that usually it's former Blue Cross Blue Shield companies can control as much as 80% of the private insurance in a state, and they've lost their ability to be pressured market-wise to be more cost competitive. I would agree. Any of the TV shows you watch, that's the number one thing they say.
I don't think they clarify it well enough, because once you start digging into these mandates, you find out that the mandates are payoffs to the various lobbying groups.
I wouldn't disagree with you.
I mean, when you think about each mandate might represent 1% of the premium.
Mm-hmm.
You put 40, 50, 60 mandates onto into an insurance policy, and all at once, you've got health insurance costing twice as much as it needs to cost.
Mm-hmm.
So the numbers that we pay for health insurance for coverage that we don't need, becomes ridiculous. And then that's just one. Then if you move along into the medical cartels, you find that the states have, or the AMA basically has established licensing laws that prohibit the ease of entry for various medical professionals. So, they've done this to restrain competition. You go into the colleges and universities, you find out that the AMA has also restricted the admission policies. It restricts supply, drives up their incomes nicely, but what does it do for the consumer? It raises costs, in turn raises insurance premiums, and there we are.
Yeah.
This is the problem that needs to be addressed.
It's interesting. Some of the we had a number of people come in that were in favor of Obamacare, and it was interesting to me that I think we had 20, and I think 18 of them were in favor, and but of those 18, only one of them was a diehard believer of Obama's thing. Most of the other ones, interestingly enough to me, recognize there's some certain problems. Sometimes it's cost, sometimes it's pre-existing conditions and so forth. And they didn't want the government to be involved. It was sort of like solve the problem or give us some options that can address these problems. And which I just thought was really interesting, because if you listen to the media, it's everybody's 100% opposed or 100% in favor of his president's proposal or what they're doing in Congress. I just found that interesting. I mean, 17 and 18 don't want the government involved any more than they presently are, which I just found that interesting.
Well, Wes, I think that says a lot.
Yeah, I
and
would
if
agree.
you really dig into to what liberty basically means, it means bringing people together, and it brings people together on all political spectrums.
Mm-hmm.
Because if you take the government out of the way, you end up with entrepreneurial solutions. And what I did, I would like to think that there's an understanding of the free market. But I reached a point where I think maybe you need a tutorial, from that standpoint. So I brought you a nice 8-page article on what is the free market, so that you could really. And I think if the last paragraph or the last sentence in this thing, says so much. Every economic problem plaguing American society today stems from some departure from the free market, which is some violation of the rights of market participants. Justice is the protection of those rights. And what is government for? It's to create an equal or level playing field for people. So justice is the protection of those rights. Social justice can only be achieved when absolutely free markets exist. Properly understood, freedom and free markets are one and the same. There it is. I would ask you to, allow the senator to read it, understand it, come to grips with it.
That on.
Because he's getting ready to retire in 2010, is what I understand.
Mm-hmm.
And what better opportunity does the man have to become a true statesman than to grab hold of the liberty movement that's going on throughout the country today? Step out and and endorse it. Resign if he needs be. I'm almost to the point of saying to senators, show me some leadership behind the free market. I received a letter from him pertaining to this issue, and it was nothing but a mishmash of commentary about state regulations that we just talked about as far as the mandates. And so it made me think that he's not focusing.
Well,
on the issue.
That's probably. I hate to say it. Those are written by staff. Here's a position paper that he put out on it recently, and I know from conversations with him that his biggest concern about this is the cost and the fact that we are so far in debt, and that's unfortunately his positions don't get picked up by the news media too frequently. Unless you're jumping up and down doing backflips or whatever, they aren't going to comment on what your positions are.
Maybe you should start doing some backflips.
Well, maybe.
I would like to see somebody, get out there. Yeah. Because the debt issue, that really, that says that says so much too.
Oh,
I
absolutely.
mean, we're sitting here as a country bankrupt, the most resource-rich country in the world, and we're bankrupt.